All right, welcome back to ABA exam review in our latest RBT practice exam series, where we're going through the next set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Be sure to check out btexamreview.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A 5-year-old is drawing on the walls at his home after receiving attention for it a couple of days ago. What type of intervention would you recommend first if you were choosing the most ethical intervention? Very important that we understand what the question is asking. At first, they're simply asking, what intervention might you use for this 5-year-old drawing on the walls? And that leaves your options pretty varied, right? There's a lot of different ways you could approach a 5-year-old drawing on the wall. But they then specify you want to choose the most ethical intervention. So what are we considering intervention-wise when thinking about ethics? Well, first, and most importantly, we always want to start with reinforcement. Reinforcement is our baseline, right? That's where we begin no matter what. From reinforcement-based interventions, we then can assess and decide, do we need punishment? Do we need extinction? Do we need these other ideas? If you're going to start with the most ethical intervention, though, you've got to start with a reinforcement-based intervention. So that's what we're looking for here. A response cost procedure. Taking away a positive reinforcer contingent on the walls is punishment. We're not going to start there if we're looking for the most ethical intervention. B, timeout from reinforcement. Timeout, punishment-based. Once again, same reasoning as why we would avoid a response cost procedure. C, differential reinforcement. So this involves a reinforcement-based procedure with an extinction component. More ethical than both of our punishment procedures because reinforcement is going to be more ethical than punishment. And then negative punishment, of course, is a punishment procedure. So drawing on the walls, it's not harmful to anyone. It's not self-injurious. It isn't a crisis. If we're going to be ethical and the most ethical when picking our intervention, we're going to pick the one based on reinforcement. So we would pick C, differential reinforcement. The task analysis identifies the following steps for using a vacuum. 1, plug it in. 2, turn it on. 3, vacuum the area. 4, turn it off. 5, unplug it. 6, empty it. If you are supposed to use a forward chain to teach this skill, where would you begin? What is the question asking? It's asking about you using a forward chain and where you would begin with that forward chain. So if you're fluent, which you should be, this is a really good example of why fluency is so important. It's a very straightforward question because with the forward chain, there's always only one place to begin. If you're not fluent, it becomes a little more difficult. Now, our task analysis, which identifies the steps in our chain, says the first step is to plug it in. So if we're going to use a forward chain procedure, we are going to let the participant or the learner engage in the first step independently, reinforce when they do, and then we'll prompt through the rest, and we'll go from there. First step, and then first and second, so on and so forth. So if we're going to use a forward chain procedure to teach a skill, where are we going to begin? Well, we're going to begin on that first step. So A, identify what steps the learners struggle with and teach those first. This is more akin to a total task chain. We're using a forward chain. B, identify where the learner stops engaging in the chain and start there. No, because we are going to start from the beginning, right? We're teaching it using a forward chain, so we need to start at the first step. C, have the learner demonstrate the first step independently, then reinforce when they do. So that's where we're going to begin. Now, if they're able to do that and then they start engaging in all these other steps first, we might adjust. But where are we beginning? That's what the question is asking. And where we are beginning is letting the learner demonstrate the first step independently and reinforcing when they do. And then D, teach the entire chain all at once. Well, that's going to be a total task chain strategy. We're using forward chain. So what are we going to do? C, have the learner demonstrate the first step independently, then reinforce when they do. I put blueberries instead of bananas into my daughter's oatmeal this morning. When I go to feed her, she looks at the spoon skeptically, so I pull away. I then put the spoon near her mouth again and say, open wide, and she does. Open wide is considered a what? All right, question is asking specifically about open wide. There's different antecedents, different consequences, different responses. They want to know about open wide. So what does open wide follow? What comes before open wide? Well, before open wide, I put the spoon near her mouth, which is the antecedent. What is our response? The response is opening her mouth to eat the oatmeal, right? So in between the antecedent and the response comes a prompt. So we know it's a prompt, right? Open wide is some sort of prompt. Now, is the prompt acting on the stimulus or is it acting on the response? Well, it's acting on the response because a stimulus prompt acts directly on the stimulus. And in this case, the stimulus would be the spoon. I'm not acting on the spoon, I'm acting on the response specifically. So this would technically be a verbal response prompt. So let's look at our options. Open wide is considered a stimulus prompt. No, because we're not acting on the stimulus. We're not acting on the spoon. B, response prompt. Yes, we're acting on the response of opening wide through verbal prompting. C, positive reinforcement. No, because it's a prompt, which is an antecedent, not a consequence. And then D, most to least prompting. Most to least prompting would begin with the most intrusive prompt, likely a physical prompt. So what we're doing is prompting the response. We're acting on the response. It's a verbal response prompt. Open wide is considered a B, response prompt. A behavior plan reads as follows. Every 5 to 7 minutes, provide the client with praise and gummy bears, even if the client is engaging in attention-seeking or aggressive behavior. How would you describe this approach? So how are we going to describe this approach? And what is our approach? Well, our approach says every 5 to 7 minutes, provide the client with praise and gummy bears. Okay, so some sort of reinforcement schedule. But then it stipulates even if the client is engaging in attention-seeking or aggressive behavior, meaning it isn't contingent on these target behaviors not occurring or a different target behavior. It's saying, regardless of what is happening, we're going to deliver reinforcement on this timed schedule. So how would you describe that approach? A, fixed interval non-contingent reinforcement. It is absolutely non-contingent, right? It is non-contingent reinforcement. I'm giving you reinforcement no matter what. No matter what is happening, you get reinforcement. It's non-contingent. However, is it a fixed interval? Well, no, because it's every 5 to 7 minutes. So it isn't fixed, it's variable. So B, differential reinforcement of alternative behaviors. We're not differentially reinforcing anything, right? We're not putting anything on extinction and reinforcing a different target behavior. What we're doing is C, a variable interval. Every 5 to 7 minutes is variable in an interval. Non-contingent reinforcement. The reinforcement is timed. It isn't contingent on any particular behavior. And of course, D, differential reinforcement of incompatible behavior. We're not using differential reinforcement in this case, right? We're using non-contingent reinforcement on a variable interval schedule. You are asked to take notes during an initial interview with a parent. The behavior analyst asks the parent when behavior most often occurs, and the parent says at night while getting ready for bed, and that the behavior occurs for no reason. What is incorrect about this statement from the parent? All right, put on your analyst cap for a second, right? Let's just assume you're assisting and you're during an assessment, you're taking notes during the initial interview. The analyst asks when the behavior occurs most often. Parent says at night, okay, while getting ready for bed, okay, and that the behavior occurs for no reason. Now, what do we know about behavior? Well, we know it's determined. It never occurs for no reason. There's always some sort of function for that behavior. So in this case, when the parent says the behavior occurs for no reason, it's just incorrect, right? And it's very common, especially with newer parents to ABA, and it's just something a lot of people think or believe when they're not trained to look for antecedents and consequences. They think behavior just happens for no reason. But we know that's just fundamentally not correct. So what is incorrect about that statement? A, the parent did not give the function of the behavior. Well, the parent's not expected to give the function. They might not even know what the function is, right? It's just, and the behavior analyst really only asked when the behavior occurred, right? So they weren't even specifically asking about the function. So that's not that big a deal. However, B, the parent said the behavior happens for no reason. That's a problem, right? We know that is just incorrect. And it's going to be the analyst's job, with your help, to teach the parent to start to identify reasons why the behavior is occurring. C, the parent did not say how the behavior looked. Topography, again, they just answered the question as best they could, which is fine. But the incorrect part about that statement is that the parent said the behavior happens for no reason. That's just not accurate. A new intern walks by the offices of the executives, hoping to get to the chance to stop and talk with one or more of them. Sometimes they are there and sometimes they are not. What type of basic reinforcement schedule is this? Our 4 basic schedules: fixed ratios, fixed intervals, variable ratios, variable intervals. Ratios depend on responses, intervals depend on time. What this looks like to me is a slot machine, right? His new intern is walking by these offices over and over and over again, so engaging in this same response over and over and over again. And he's only occasionally receiving a reinforcement, right? Because sometimes they're there, sometimes they're not. He doesn't always get a chance to stop and talk with them, but he continues to walk by. It's like a slot machine. I keep pushing the button over and over again. Sometimes they get reinforced, sometimes I don't. Okay, so it's not based on a fixed number of responses, right? There's no exact timetable for him to see these executives. He just needs to keep walking by over and over again, and eventually one of those responses will be reinforced. So what type of basic schedule is this? Well, we know it's not an interval schedule. We know it's not a fixed ratio because it's not a fixed number, right? It's just an average, or he can't predict it. It's unpredictable, right? So it's a variable ratio. The first response, right? The first walk by of the day might produce reinforcement. It might take 5 walk bys to produce reinforcement. He can't predict it. It's an average. It's variable and is based on responses because he's just got to keep engaging in those responses over and over again. Eventually, right, he will get reinforced, but he can't predict it. So what type of basic reinforcement schedule is this? Well, C, a variable ratio. A task analysis is needed to identify the steps of depositing a check at a bank. Which of the following choices is not a priority of a task analysis? Now, the task analysis comes prior to the task chain. We take a complex set of skills, or a complex behavior, I should say, and break that behavior down into manageable, teachable skills. And it's a very important part of teaching, especially children and people with disabilities. So when that task analysis identifies steps, as let's say depositing a check, what is not a priority? A, the client's age. Well, the client's age may matter. It might determine how many steps, the difficulty of the steps, what steps you're using. So the age is a priority. You need to be aware of how the age affects their skill level and their performance. B, the convenience of the task analysis. It's really not supposed to be convenient. Well, maybe it is, but that's not our priority, okay? Working in this field isn't always convenient to us. It's not really what we're trying to accomplish, though, right? We're trying to do what's best and right for the client. We're trying to help the client what works for them, regardless of is it convenient or not to us. That's certainly not a priority. What about the client's skill level? Well, of course, again, it affects how many steps, the level of difficulty, how you're going to teach the steps, and then the experience. Age, skill development level, and experience all play a part in the steps you choose and how you teach those steps. What really isn't a priority is it convenient to you or not? A behavior technician is assigned a new case. The supervisor tells the technician that there is a restraint strategy written in the behavior plan, but it has not been used yet. Before starting the case, what should the behavior technician do? So prior to starting the case, this behavior technician has to do what? What do we know about the situation? We know it's a new case. We know the supervisor says there's a restraint strategy written in the behavior plan, but it has not been used yet. If there's a restraint strategy written in, you can safely think, well, okay, there's a potential of me having used restraint, meaning at some point myself or somebody else might be in danger of harm. So before starting that case, what does the behavior technician need to do? And this is important for you if you're going to be working with anybody who has self-injurious or aggressive behaviors that might require restraint. A, ensure they are competent in the restraint procedure. Absolutely. Restraint is very dangerous. It can be very harmful. If you're not well trained in restraint, you should not be using it. B, fully understand what would lead to needing to use the restraint procedure. Absolutely. You need to understand both the behavior plan, the antecedents to consequences, and the crisis emergency plan. Restraint is a last resort intervention. It is the last thing we go to when nothing else works. So you have to fully understand why you need to use restraint and when. And then C, be familiar with the laws and rules regarding restraint in their state. Yes, laws, there are laws around restraint, there are rules around restraint, there are things you can and can't do with restraint. You've got to know these, and your analyst has to know these. If restraint is written in, you've got to cover all these bases. Make sure there's a crisis emergency plan. Make sure you're competent. Make sure you understand when you need to use it and when you don't. You need to know the laws and rules. The reason there's so many steps is because restraint is very serious and it can be very harmful when used incorrectly. So what do? Make sure you're competent. Make sure you understand and be familiar with all laws and rules regarding restraint. So D, all the above. Thank you for watching. Check out btexamreview.com for all of our study materials. As always, let us know when you pass so we can include you in the Sunday shout out. Work hard, study hard. See you soon.